Following question is for Dorian and Vanessa, starting with Dorian. Although we hear that we have a comprehensive universal health care system funded by tax dollars, communities are required to raise significant amounts of money to fund essential medical equipment and technology that is not covered by government funding. How would you support hospitals to replace expensive equipment and technology?
I think that, again, the difficulty that we as members of the Progressive Canadian Party are facing is the realization that the Harper government is not maintaining its federal commitment to the Canada Health Act. We are totally committed to that Canada Health Act. We are utterly committed to one level of health care for all Canadians. And to answer your question, we believe that the funds currently designated by this the previous federal government before the writ was dropped are nowhere near what they should and could be. So our mandate would be to increase those funds and to make sure that the Canada Health Act is supported the way it should be for all Canadians, and that would translate into the local hospital here reducing wait times significantly. Thank you.
Thank you for the question. The Green Party believes, and I believe as well, that community participation is a key part of any healthy community. So we would certainly encourage people to get involved with their health care. Part of that is getting people out of the hospital and broadening the community healthcare provisions so that people receive care in their homes, they receive care in smaller centers. When people have buy-in to their communities, they will be more involved with raising funds. I also agree with Dorian that we need to be putting more money into our healthcare, into most of our social services. They have been cut and cut and cut by both of the previous parties that were running the government. For the last 15, 20 years, the services have been cut and we are suffering. And while we can say we're coming out of the recession, it's time to ask ourselves, is our quality of life really getting better?
We received